welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about good cholesterol's role in universally predicting heart disease risk is challenged. A National Institutes of Health supported study recently found that while low levels of the HDL cholesterol, it predicted an increased risk of heart attacks or related deaths for white adults, a long accepted association, the same was not true for the blacks. Additionally, higher HDL cholesterol levels were not associated with reduced cardiovascular disease risk for either of the group. The team wanted to understand this long-established link that actually labels HDL as the beneficial cholesterol, and if that's true for all the ethnicities. To do that, Pamir and her colleagues reviewed data from close to 24,000 United States adults who participated in the Reasons for Geographic and Racial Differences in Stroke study. Previous studies that shaped perceptions about good cholesterol levels and heart health were conducted in the 1970s through research with a majority of the white adult study participants. While for the current study, the researchers were able to look at how cholesterol levels from black and white middle-aged adults without any heart disease who lived throughout the country overlapped with future cardiovascular events. The study participants enrolled in the REGARD study, and also the researchers analyzed information collected throughout a 10 to 11 year period. Black and white study participants shared similar characteristics such as age, cholesterol levels, and also the underlying risk factors for heart disease, including having diabetes, blood pressure, or even smoking. During this time, 664 black adults and 951 white adults experienced a heart attack or even heart attack related death. So adults with increased levels of LDL cholesterol and triglycerides had modestly increased risk for cardiovascular disease, which aligned with the findings from the previous research. So the REGARDS analysis was the largest study to actually show that this was true for both black and white adults, suggesting that higher than optimal amounts of good cholesterol may not provide cardiovascular benefits for either of the group. The authors hence concluded that in addition to supporting the ongoing as well as the future research with diverse populations to explore these connections, the findings suggest that cardiovascular disease risk calculators using HDL cholesterol could lead actually to inaccurate predictions for black adults. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.